What happens if your Pap test results are abnormal? Imagine sitting in your doctor's office, waiting to hear what your Pap test results mean. An abnormal result can feel unsettling, but it does not mean you have cancer. Most people with abnormal Pap results do not have cervical cancer. Instead, the test shows that some cells in your cervix have changed. These changes can be caused by infections, inflammation, or precancerous conditions. Your healthcare provider will recommend follow-up steps to find out what's really going on and whether treatment is needed. When your Pap test results come back, they are usually categorized as normal, abnormal, or unclear. The most common system used to describe these results is called the Bethesda System. It classifies findings as negative for intraepithelial lesion or malignancy, meaning no abnormal cells were found, or as epithelial cell abnormalities, which indicate cell changes. Sometimes results can suggest low-grade or high-grade lesions, or even more serious concerns like precancerous changes. It is very important to follow your healthcare provider's advice after an abnormal result. They will consider your overall health, your previous screening history, and whether you have had any treatments for cell changes before. This personalized approach helps determine your risk of developing more serious problems later on. Depending on your situation, your provider might suggest repeat testing in 1 or 3 years if your risk is low. They might also recommend a procedure called colposcopy, which allows a closer look at your cervix using a special magnifying instrument. During this exam, they may take a small tissue sample called a biopsy to analyze the cells more precisely. If the biopsy shows precancerous cells, these are classified as mild, moderate, or severe dysplasia, also known as cervical intraepithelial neoplasia. About 60% of mild cases tend to resolve on their own without treatment. However, moderate or severe changes usually need intervention to prevent progression to cervical cancer. Treatment options for these more serious changes include procedures that remove or destroy abnormal cells while aiming to preserve your cervical health, especially if you want to have children someday. One common treatment is cryotherapy, where a doctor uses cold nitrogen gas to freeze and kill abnormal cells. This outpatient procedure takes about 15 to 20 minutes and usually causes some cramping or discomfort. Laser therapy is another option, where a focused laser beam burns off abnormal tissue. It can be done in the doctor's office or in an operating room, depending on how extensive the abnormality is. The loop electrosurgical excision procedure, often called LEEP, uses an electric current through a wire loop to remove a section of the cervix containing abnormal cells. LEEP not only treats the problem but also provides tissue for lab analysis to check for invasive cancer. Because it can cause some damage to the cervix, it is used carefully, especially for women planning future pregnancies. Other treatments like laser therapy and cryotherapy are often preferred for younger women or those who want to keep their cervical function intact. These procedures are quick, outpatient, and have minimal recovery time. If more advanced cervical cancer is found, treatment options may include chemotherapy, radiation therapy, or surgery such as a total hysterectomy, which removes the uterus and cervix. Sometimes, for high-grade or persistent abnormalities, doctors may recommend immediate treatment without a biopsy to reduce delays and risks. Your healthcare team will tailor your management plan based on the severity of the cell changes, your age, your desire to have children, and your overall health. Working closely with specialists ensures you get the most appropriate care. The key point is that an abnormal Pap test is a prompt to take action. Early detection and treatment of precancerous changes have greatly reduced the number of women developing invasive cervical cancer. By following your doctor's recommendations and maintaining regular screening, you are actively protecting your health and reducing your risk of serious issues in the future. Always remember to consult your healthcare provider for personalized advice and care.